Good afternoon. I'm Bevan, the City of Milwaukee Health Commissioner, and thank you for joining us today. I wanted to give you a brief update. I'm joined by Dr. Geof, Swain, who's the Chief Medical Officer for the Milwaukee Health Department, and Paul Biedrzycki, who's the Division Head for Disease Control and Environmental Health. I want to try to give you as much information as we have possible, but please understand that this is an ongoing investigation, and information is rapidly evolving, not only here in Wisconsin, but across the nation and globally. I'll be brief on this, and then we'll take some questions. As of this time, there are no confirmed cases in the state of Wisconsin or the city of Milwaukee. And again, this is a fluid situation, and that could change at any time. On Sunday, the City of Milwaukee Health Department activated its pandemic influenza preparedness plan. We have 5 key strategic areas in that pandemic preparedness plan: risk communication and messaging. We're pushing information to schools and healthcare providers and the general public to minimize fears and panic. Surveillance and case management is another component, which enables us to identify cases and look at potential disease trends in the community. Disease control in the community, that's another key component. Here we're looking at contingency planning to look at the impact of potential closures or limitations of public gatherings. We have to look forward to see if that's going to be a concern in the future. Healthcare control, infection control and clinical management, it's another key component. Here we're looking at have clear guidelines on testing, antiviral use and testing of samples. And we're also looking at surge capacity at this time. What happens if this evolves? How will we need to surge forward here? And we're looking at interagency and governmental coordination. We're having key contacts at the state and the federal level with all elected officials in our region to make certain that we can continually brief them so that if we need to enact legislative powers to do our preparedness effort, we'll have the opportunity to do so. At this point, our primary focus is on risk communication, pushing messaging out to the community and also looking at implementation of our action plan. It's a 5-pronged approach. It's critical in every outbreak, but it's even more critical here. What we've done so far is we've connected with the state's largest school system, Milwaukee Public School System, and we've had alert messaging to them to monitor absenteeism, to look closely for clusters of disease, and then report that back to us. Those are sentinel events in our community, and we need to know about them. We've begun similar conversations today with charter and private schools. We're also asking them to do the same. We have also developed these communication channels with our local colleges and universities and also large employers. This is key because we had also done influenza pandemic planning with these large universities and large employers years ago to prepare them. So they're at the ready, they have plans, and now we're asking them to invoke those plans and be prepared to interact with us. We've also implemented our auto-dialing function for messaging to private healthcare employers here in Milwaukee County. And this is every healthcare employer who may come in contact with the public. And that is working as we speak. We've also reached out to our physician-led organizations. There are 2 major ones here in town, the Medical Society of Milwaukee County and Cream City Medical Society, which houses most of physicians in the city. We're messaging to them so that we can have an interactive relationship with our physician community. We activated our flu hotline last evening, and it went completely live with voices on the other end of the line this morning at 8 a.m. We logged over 200 calls. Approximately 60 to 70 of those calls have been individuals who zeroed out to talk to live persons. They've gotten the information, but they wanted a little bit more. The majority of those callers are asking about signs and symptoms of disease and also travel to the affected areas. The update, as you know, the U.S. cases have doubled since we last spoke to 40 as of 1 p.m. today. And in most cases, we're seeing these global numbers go up, especially in Mexico. And around the world, we're knowing every hour that we have an increasing caseload. And while there are no travel bans in the U.S., the CDC has indicated they plan to recommend against any non-essential travel to Mexico at this time. Most people in the U.S. who have swine flu so far have recovered or had mild symptoms, and only 1 hospitalization has been reported. While that is good news, certainly one must be on the lookout for changing aspects of this public health outbreak. what we in the public can do. I'm pleased to say that we've got numerous calls here at the health department from the public, healthcare providers, large institutions, but also men and women in the city of Milwaukee asking what they can do to assist us in our pandemic preparedness planning. We're asking people to watch for signs of swine flu. We're asking them to look at their symptoms, and if they have those symptoms of human flu, which include fever and cough, sore throat, body aches and headaches, chills and fatigue, that they would also look at their travel history, look at whether or not they've been in contact or in the regions where there have been cases confirmed. And if they've recently traveled to an infected area, we want them to actually call their healthcare providers. For others, you should watch your symptoms, and you should stay away from others. Stay at home from work if you're working, and stay at home if you are school age and you're attending school. Swine flu spreads person to person when a person is infected with flu, coughs, or sneezes. So it's important that we take those normal precautions that we do with any case of influenza. We've got to do what we learned so long ago. We've got to wash our hands and cover our nose and mouth. I know we've said that many times, but if indeed this is an emerging global pandemic, it will never be more important than it is on this today. We know that alcohol-based cleaners are effective, and many of us have them, but never are they more needed now than at this time to ward off disease in our community. We're asking people to use common sense and to think about the messaging that we're putting out and others are putting out, to avoid contact with people who are sick, and to have a good working relationship with your provider so that if you believe your symptoms cross to that line or you have to seek medical advice, you'll do so. So reiterating, there are no confirmed cases here in the city or in the state, but the work that we must do to prepare for that sentinel case in the state of Wisconsin and the city of Milwaukee is here and is now. And we have a lot of folks working on the ground to deal with this issue and to deal with the risk communication part of our plan. So we move on to surveillance and management, and we will continue that. We'll be standing up and pushing information daily as the situation changes. With these updates, we want to take any questions that you may have at this time, and understanding this is an evolving outbreak, and we'll try to give you the information as soon as we can. We don't have all of it, but our scientists and our medical providers are working tirelessly to give you these information as soon as we can validate it. So
Commissioner, how many suspected cases are you aware of where someone has the symptoms but are waiting for the test results to come back?
What I do know is that the state of Wisconsin had 10 suspected cases or samples, and they confirmed all those to be negative. We do know that our state lab of hygiene is currently receiving samples, and they will continue to receive samples during this outbreak. And they have to meet the criteria. That criteria, that case information is being set now by the CDC and the state. And I think that those samples, they meet the criteria, will be suspected cases. But 10 samples have been pushed back as being negative, and that's good news for the state of Wisconsin and the city of Milwaukee.
What's being done to reach out to the Hispanic population here in the Milwaukee area, given that there's cases coming from Mexico?
Well, certainly one of the key things that we can do is to have a relationship with physicians who are providing care in that community. And we pushed our messaging to them. We've reached out to both medical societies and the city that has membership there. The other thing is that we're making certain that our messaging is linguistically and culturally appropriate. We translated all the materials in Spanish. And we are pursuing the option of having a two-way dialogue. We want to open ourselves up for individuals from that community to actually reach out to the health department. We'll go, and if this thing continues to unfold, we'll go into that community and actually have a two-way dialogue. The other thing is that we have outreach staff. And outreach staff are working with not only the large medical providers, but our clinics provide healthcare to those who are in the underserved community. And then we're listening at the national level in terms of efforts that are being made through federal and state partners to reach our Spanish-speaking population. So through physicians and through medical providers, through our hospitals and emergency departments, we're pushing information, but also our hotlines are the way we're reaching out. And we'll do more if necessary